everyone, and welcome back to our podcast series. Last time around, we had a pretty informative session on the structure of the Indian healthcare system. Here is Urva to start us off on this new episode.
It was so good to hear from Parvathi about the way healthcare in India is structured. But does this really overcome the problem of still families not having access to affordable and quality healthcare in India? The latest National Statistical Office NSO report on the consumption of health services in India shows us that along with affordability, infectious caused due to hospitalization and lack of clinical hygiene is alarming.
On another note, gender is one of the main social determinants of health, which includes social, economic, and political factors that play a major role in the health outcomes of women in India and access to healthcare. Numerous studies have found that the rates of admission to hospitals vary dramatically with gender, with men visiting hospitals more frequently than women. Differential access to healthcare occurs because women typically are entitled to a lower share of household resources and thus utilize healthcare resources to a lesser degree than men.
Yes, Parvati is absolutely correct. Furthermore, it has been found that Indian women frequently underreport illnesses. The underreporting of illness may be attributed to these cultural norms and gender expectations within the household. A study by CHOI in 2006 found that boys are more likely to receive immunizations than girls in rural areas. This finding has led researchers to believe that the sex of a child leads to different levels of healthcare being administered in rural areas.
That's quite disturbing. We hope that going forward, these disparities will go away. Now, many people in India rely on government hospitals as they are considered standard and inexpensive. But when we look at the situation of government hospitals in India closely, we find a number of inadequacies in it. Healthcare differences are prevalent between poorer and richer states, with underfunded health systems that in many cases are inefficiently run and underregulated. Lack of basic medical facilities and poor sanitation conditions in the government hospitals across few states have added to the adversities of ailing patients, as per a reality check operation conducted in these hospitals by ANI. We as humans are prone to a lot of diseases, and having proper healthcare facilities is our right. India has mixed healthcare system inclusive of public and private healthcare services providers. However, most of the private healthcare providers are concentrated in urban India, providing secondary and tertiary care healthcare services. People who are wealthy enough to pay don't like poor service.
The quality of doctors at the state hospital is not the issue. The system is very understaffed compared to other countries, but there is almost no waiting time for surgery compared to other countries with a high doctor to patient ratio. And we have the cheapest consulting fees in the world as well despite shortages. But these shortages make the other factors higher.
Rounds are played in teams, so decision making is very precise. The problem is poor infrastructure and emergency medical care. Procurement for public hospitals is done through a division of bureaucracy. Maintenance is an even bigger issue since most things are hanging in the air. As a patient or family who can afford the best medical care, I certainly do not want to use poorly maintained surgical instruments.
It's also seen that the healthcare facilities in India are entrepreneur driven. About 60% of medical care, including surgery, takes place in small clinics and nursing homes run by a single doctor or a couple. A small portion is provided by corporate hospitals and the rest is provided by governments and other public or non-profit trusts. Some hospitals have cutting-edge technology and human resources while most lack basic infrastructure.
In short, India's healthcare system is in utter chaos, with political favoritism and interference ruining an already pathetic system. Instead of improving and creating basic public sector infrastructure, governments have taken shortcuts by forcibly recruiting vast numbers of health entrepreneurs through various laws, creating resentment over an unprofitable health economy. Essentially, without spending a dime, the government nationalized medical facilities and forced them to provide services at government set prices. All private health contractors today are unpaid public servants and face constant threats of deregistration, imprisonment, and fines.
Crowds at public hospitals also mean doctors can't give enough time to each patient. Staff also develop a habit of being short and snappy in their conversations. This may seem disrespectful. In fact, so many patients are so burdened that many staff are disrespectful. Overwork and understaffing for a large number of patients means a higher potential for error.
Those are some ominous facts. That brings us to an end to this episode. We will be back with a new episode elaborating a bit more about the scenario, possible causes, and the way forward. See ya!